We're here at the 22nd CROI, and we're honored to have Deborah Birx, who is ambassador to PEPFAR and the Global AIDS Coordinator. And we really appreciate you taking the time away from the conference to enjoy a moment with me. And I must also say that I really appreciate you taking the time to spend with some of the community members, the community scholarship recipients this morning.
Yes.
They're doing a great job this year, some of the advocates and activists that work with the committee and on the committee to bring to the community some of the people who are movers and shakers, and you're certainly a mover and shaker. But mostly in science. You were probably the only one that wasn't in science. But it's important for the community to play a role, and I think that's one of the most important things we want to talk about today is the role of the community. You actually ask them, how you need to help us work with the local folks so that we can make all these changes happen in a very amicable and agreeable way. And it was funny because Wakefield, one of the people there, were saying to me, we've got to ask her what we can do. I said, well, we're all asking, so now we just have to get together on it. We're agreeable that we need each other. It's definitely a partnership. So tell me some about the partnership that you're building, albeit very wide. It's not just community, it's governments, it's scientists, it's doctors in small communities. It's a massive project. It must be daunting.
No, it's a privilege because it's a kind of accumulation of everything that I've ever done. I started out as a clinician in the clinic. I was a clinical immunologist at Walter Reed. It was a very difficult time throughout the early 80s. The military wasn't always welcoming to individuals that were men having sex with men. And yet they were dying from a terrible disease that we didn't know. We didn't even have an antibody test at that time. So I was an immunologist called in to work with the patients. When you have been trained in high-tech medicine and you believe that you can solve anything, to be overwhelmed and personally affected by your patients dying beside you and you couldn't save their lives, it was, I think, a very reflective time for really many of the physicians and nurses that were engaged in HIV/AIDS care. But what was very striking throughout the whole experience is the community partnership and the friends of the HIV-positive individuals who were dying themselves, who sat at the bedside to bring dignity to those who were dying. So I think it's a continuation of that work through basic science when I worked on vaccines, and now to program, and being able to bring those skills and that knowledge of how important you have to work with the scientists who are bringing new inspirations from the bench through clinical trials that we can pick up at program and take them to scale, to the community that has to be part of that effort from the beginning, to be knowledgeable about what everyone's trying to do, and also be that opinion leader in the community to really bring those messages to everyone about whether it's prevention, whether it's care, whether it's treatment, whether it's adherence to treatment, and to make sure that we have consistency in those messages, but messages that are adaptable to the communities that we serve. So I think it's a matter of service over time, and it's an exciting time to be part of the field because I think for the first time we have clarity on what to do. It's just doing it fast enough and focused enough to have an impact on the epidemic.
This morning you seemed impatient with the hopes that you had for moving money around. I was talking to Carl Diefenbach. He said it's a matter of moving appropriate resources to the appropriate places.
Yes.
Because it makes no sense to distribute it evenly across a state in Africa or Southern Africa because obviously they have different needs. Some of them don't have any needs in a small province or a jurisdiction. And another, it's huge, where it may be more central or more urban or more suburban or more urban or whatever it is that makes the difference. So you said some of the times there are people that believe that they're having resources taken away, but the resources are not necessary. Is it hard to explain to them why this is needed and why it's necessary to make those shifts in the dynamics?
Well, I would say that everybody who has worked with me over the last 30 years would say I'm an impatient person. So it's not unusual for me to bring this level of impatience to this position, because people every day are becoming infected, 35,000 this week. We don't have an additional $18 million in resources to bring treatment to those new 35,000 individuals who are infected. So I feel a great impatience to translate the tools we have into controlling the epidemic. We've been working closely with countries, and many countries have led on this. I don't want you to feel like it's a PEPFAR initiative. Both South Africa and Kenya have completely analyzed the country down to the county level or the district level and know where there's HIV and a significant problem with increasing number of infections, and where there's very little HIV. The next big issue is translating that data into action. And taking that knowledge and making it actionable and pivoting the program to serve those individuals in the higher need areas. And so yes, it does matter. It does mean shifting some resources. All of us would have liked and would still want to be able to do everything everywhere for everyone, because that's easier. But in our current situation throughout the globe, between the Global Fund and the host country resources and PEPFAR, we have an opportunity right now in this moment to focus our research resources in a way that we can serve more individuals, prevent more new infections by bringing new prevention innovations like we've described in DREAMS for young women, bringing new treatment innovations, which following the WHO guidelines, getting to B+ for pregnant women, ensuring that their health is preserved and their babies protected, and making sure that we do that in a quality way. So we're triangulating down at the very granular level of the site and saying, what are we doing at that site? Are there HIV positive patients? What are the results? What are the quality of those results? And what's the cost of achieving those results? And how do we get to a more effective and efficient program? And we've been working hand in glove with countries. Anytime you're talking about moving things, the United States had to go through that, where they had to really align resources, where HIV was more of a problem. And that's what we're really discussing with countries now. But I've always been impatient, because it's my nature. But don't interpret impatience as concern. It's just that I want to move quicker because the need is great.
And the prevention, so the resources you're moving are not just for treatment, it's prevention as well.
Exactly.
And
Exactly.
do you have any, is there any resources that you're getting or working with in partnership with, say, the Gates Foundation or with Bill Clinton Foundation? So
we've worked for decades with the Clinton Foundation. They've been a great partner when I was at CDC, working on a whole series of laboratory initiatives, and they continue to be critical to the field. They've brought down the cost of ART for all of us. They've brought down the cost of viral load for all of us. Viral load is now at a cost that we can actually take it to scale in countries, and we're working on that right now. And that's part of the 90-90-90. The last 90 is to get that viral load out there, and we're committed to that. With the Bill and Melinda Gates Foundation, we have a series of partnerships. We do pink ribbon, red ribbon with them on preventing cervical cancer in HIV-positive women. But they become part of DREAMS, which really stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, Safe Women. And it's focused on women between the ages of 10 and really 19 to prevent infection between 15 and 24. And it's really bringing together the talent base and the innovation of the Gates Foundation with the incredible branding, messaging of the Nike Foundation. And I think we're excited about U.S. government dollars coming together with the ideas and the innovation that these other teams can bring to us, because infections, both heterosexual transmission and infections in young women, continue to rise despite all of our efforts, and we have to really address this in a comprehensive way. And so this is what DREAMS is about, and that's where our focus is going to be. We're not just focused on treatment, we're focused on the best prevention combined with the best treatment and care.
Do you find that each of the elements that you mentioned so far, World Health Organization, Bill Clinton, and Gates Foundation, et cetera, that they have a certain sense of expertise, that you rely on them to maybe do some negotiating or, you know, community awareness or like say branding or promotional, et cetera? Is this something you kind of get to know each other's strengths and weaknesses?
Well, you know, I've always believed it takes a village, and I have no problem asking for help. And we know what the emergency is. We know we have expanding number of new infections. We have limited financial resources, yet we have to create an AIDS-free generation. When President Obama announced that, it became more than saving lives. It became actually changing the curve of the epidemic, and we're committed to that. We've been working very closely with UNAIDS. They've been a critical partner in all of this. They've really laid out a lot of the epidemiology, and we've translated that just down to a more granular level. WHO has provided us the guidelines and the normative guidance that we all should be following. We're trying to translate that into action across the globe. And I think what the private foundation, both the CIF private foundation, which is the Children's Investment Fund, along with the Gates Foundation and others, bringing their resources. The U.S. government money sometimes can't do certain things, or we don't do certain things well, and they can bring those things that they do particularly well or can fund particularly well. They also bring a business acumen that I greatly appreciate. I don't think there's that much difference between science and business. We look at data and we make decisions. You wouldn't open a Starbucks where no one's going to buy coffee. So we shouldn't be working where there's no HIV. So business people are really important to our progress. And then I think the private sector, like the like the Nike Foundation, and their insight into the adolescent mind is particularly intriguing. It's amazing to me in this day and age, they still have teenagers buying Air Jordans. And Michael Jordan was my hero. And I'm a little bit far removed from that adolescent stage. So I think really utilizing their unique talent base has been important. People have come forward to help us. And that's been the exciting thing over the last 10 months. The number of people, the number of foundations, the number of private sector groups who have said, you know, we appreciate what you're trying to do with accountability and transparency and your focus on impact, and how can we help? Well, in the same way with the community, you heard that this morning, the same thing, how can we help? It's an exciting time.
The Nike Foundation is, I know that because we've gone after them for support, and the programs that they do are all supporting young adolescents in health.
Yes.
And so this is their bailiwick, and they really work hard at it. And I think it's no stretch for them to step into the AIDS arena and help countries around the world wherever they can. So yeah, it's amazing. So and the other thing that some of them are better at doing is growing the population of other corporations that want to collaborate with, if not contribute to, the Clinton Foundation and Nike and all those that develop foundations that are kind of going in the same direction you are, but you are separate, you're the government, so it makes it a little bit different in the way you can approach a business program, if you will.
Yeah, I think we have a lot of respect for public-private partnerships. We've done a lot of those within PEPFAR. Ambassador Dybel started those programs. Ambassador Gooseby expanded them. We're really looking for a private sector who understand what we're trying to do and can bring their unique talent base to that objective. And I think it's been very exciting to see the numbers who have come forward. I think part of it is making our data more accessible. All of it's on the website now. All of it's at pepfar.gov. The community can see it. Countries can see it. The business private sector can see it. And they can really see where our dollars are going and what we've been achieving and where we could do better. And we're putting all of our information out there, knowing that there are areas that we haven't been perfect, and we're willing to display that level of transparency so people can understand what we're trying to do and provide us additional insights and how to do it better.
And who do you normally negotiate with? Do you negotiate with the secretaries of health of various countries or health departments? Or?
That's an interesting question. So we have been working very closely from the very beginning with the Minister of Health. Usually there's an AIDS commission. Sometimes it's called NACA, sometimes NASCOF. And we've been working very closely with the health side of the sector. We've brought in someone into our group from our U.S. Department of Treasury because we realized that we all understood the health issue and the health risk, but we needed to make a better business case to governments and to the ministries of finance so that they understood that investing now ends up saving money in the long run and creates economic gains and productivity and making really those business cases for ministers of finance. And so it's not something that health people can do perfectly. So we brought in economic experts to really help us with those analyses. Yes, with analyses. Mike Ruffner's come over from the Department of Treasury, and we're excited about that. And USAID has come forward with an innovative health financing program that we have funded. CDC has come in with a new impact agenda analysis. Peace Corps has come in to look at supply chain, and NIH continues to really support us with implementation science. So although I'm at the State Department, I am wrapped around by amazingly competent agencies that really want to see impact and want to see PEPFAR go to the next level.
And bringing the right people to the table is really important from your bailiwick.
Yes, exactly.
I know that when I was at a number of the conferences over the years, I've been, graciously allowed sometimes special help to get into some of these meetings or private meetings with some of the past presidents of countries where they made it to a conference, an AIDS conference. And almost always they become kind of a different person, like Clinton did. When you leave, they feel like they've left a vacuum, that they didn't do certain things they wanted to do, and this is, I guess, what motivates President Clinton, the sense that he didn't quite do all he wanted to do when he was in office, and now he can do it in a different direction. But there was a number of past presidents that I've talked to over the years that have worked together to form a collaboration to encourage, almost lobby their own other presidents that are in action right now and saying, don't do what I did, do more. And so I think that might be another opportunity for you to collaborate with them, where they have a little bit of an arm twisting, if you will, to get a little more action into and to make things happen that otherwise might take a little longer.
Well, I think the Clinton Foundation has worked in the field not only in health, but with Secretary Clinton's work in gender and education and the new announcement at CGI about an education initiative really focused on young women and secondary schools and opportunities. There is a movement now to move forward, and it doesn't all have to come from PEPFAR. We can utilize the amazing work of others, and I think what you see from the ex-presidents is a continued impatience to make the world better. You see that from President Carter, you see that from President Clinton, you see that from President Bush with pink ribbon, red ribbon, and the work that they want to continue to do, because I think they went in to be a president because they wanted to make the United States better, and they come out of it saying they want to make the world better, and it's really extraordinary. They all have made more and more impact.
They get too busy when they're in with the tedium and the administrative piece of it, that the passion has to leave for a moment. Then it comes back after they now have no more administration to do, and they now feel they can be almost benevolently participating in improving the world. And it's very admirable when they do that. Of course, I guess they don't have a lot else to do, and they have this power that seems to be there and surrounds them, being a past president.
I think there's a lot of other things they could do, yet they choose to do this.
They could play golf.
Yes, exactly. And they would deserve it after everything they went through during their presidency.
Nobody comes out with any natural color. It's all gray by the time they're done. No, I can. It's probably the most stressful job in the world, and being a president. So I know this is something that I honor all those that do the work, whether it be in another country or our country.
Yes.
And I really appreciate the work that you're doing, and I honor you for that, and I hope that I wish you all the best support that you can get, and I encourage you to ask our community for all the support we can help you with.
Great, I will, and remember that the United States is part of the globe, and we can't, I talk to Doug Birx all the time from ERNAP and making sure that We're doing as much we can domestically to ensure we decrease the number of new infections, and we make sure that there's less disparity and there's less infections among young men of color, just like we're doing globally. So we include that United States in the response, and we're excited about the connection between Doug Birx and myself and bringing those pieces together.
Great. Thank you so much for doing the work.
Thank you.
Thank you.
Great meeting you.